We're going to talk about movement patterns of different kinds of synovial joints. These are important to know, so please follow along carefully, and you can highlight them in your book if you like. You will need to know these for when you write the exam, and also when you start talking about different actions of different muscles. We're going to be looking at movement patterns: flexion, extension, rotation, abduction, adduction, and the list goes on. It's easier to understand what we're trying to tell you if you look at what's called an anatomical position. For the purpose of description, the body is considered as being in an anatomical position. Here you can see a muscle man standing. In this anatomical position, it's assumed that the feet are facing forward, the arms are at the side with the palms facing forward, the head and the eyes are also facing forward. To ensure consistency of description of movement, it's important to keep the anatomical position in mind. So remember, if you were standing, you would really have your palms at your side, but in an anatomical position, the palms face forward with the thumbs at the side. Any movement that you do comes from this position. Flexion means to bend or decrease the angle between two bones from a normal anatomical position. That means if you were standing in an anatomical position and you bent everything forward, that would be flexion of all the body parts. Let's have a look here. You can see in this picture, the woman has her chin down on her chest. She's flexed at the neck. As she brings her arms up, she's flexed at the shoulder. Her elbows are bent, so she's flexed at the elbow. She's bent at the waist, so she's flexed at the waist. Her hips are brought up, so she's flexed at the hip. And her knees are bent. She's also flexed at the knee. This is a great way to remember all the movements of the body as far as flexion is concerned. We're going to talk here about flexion. If you have a look at this picture, you can see Julia standing on one leg. You can see that she's flexed at the elbow, meaning that the elbow is bent. She's also flexed at the hip, as she's drawn the knee upwards and decreased the angle between her thigh and her torso. Julia is also flexed at the knee as she's bent the knee and decreased the angle between her thigh and her calf. The rest of the joints are extended, but we'll talk about that in another section. Here you can see Steve is flexed at the elbow. However, his arm is out at the side, which means he's abducted at the shoulder. His elbow is bent, so he's flexed, but his arm is out to the side, so he's abducted. If his arm was forward of his body, his shoulder would also be flexed. But because it's at the side, going on a different plane of motion, it's not called flexion, it's called abduction. Steve does look like a happy fellow, doesn't he? So we're going to talk a little bit more about flexion here. In the top left-hand corner, you can see Julie is doing the out phase of a row. She's flexed at the shoulder, meaning that her arm is coming all the way forward. In flexion and extension motions, the body moves forward and back, or the arms move forward and back. So on the top left-hand side, you can see Julie has her arms forward, and that is flexion at the shoulder joint. In the bottom left-hand picture, you can see Lauren is bringing her arm upwards. This is also called flexion at the shoulder joint. On the picture on the right, you can see Lauren has not only brought her arm up, but she's brought it all the way up by her ear. This is called full flexion of the shoulder joint. So if you see this on the exam, you're going to know that full flexion of the shoulder joint is caused by the deltoid muscles, and we'll discuss that a little bit further on. Extension is to increase the angle between two bones. If you look at the picture of the woman on the left, her arms are straight, so she's moved the bones away from each other. She's also extended at the waist, and she's extended at the knees. The woman on the right, if you look at the right side of her body, her elbow is extended because she's straightened it out. Her shoulder is extended as she's moved it back of the body. If you look at her right leg, she's flexed at the hip, however, but she is extended at the knee. She's straightened the leg at the knee. If you look at the woman's left leg, she's still flexed on the hip of that left leg, but she's flexed at the knee. If you look at her left arm, she's flexed at the shoulder, meaning that she brings the arm forward, and she's flexed at the elbow. So extension is to increase the angle between two bones, and flexion is to decrease the angle between two bones. If you were to stand up like the woman on the left, you would be extending at all the joints. If you crouch down into a fetal position, you would be flexing in all your joints. We've talked about flexion. Now let's have a look at extension. In the picture in Julie doing the in phase of a row on the top left-hand side, you can see that her arms are brought back of the body. So Julie is now extended at the shoulder joint. However, her elbow is flexed, and you'll remember that flexion is to decrease the angle between two bones. So she's had to flex her elbow, but she is extended at the shoulder, which means her arms are brought back. If you look at the picture of Sean on the bottom left-hand side, he has gone into an up position from the spinal extensor exercise. This means he's extended through the spine. If he were to go down, he would be flexed at the spine. If you look at the picture of Julia on the right-hand side, her arms at the shoulder are very much like Julie's, where her arms are down by her side. So at the shoulder, Julia is extended at the shoulder joint. But you can see her elbows are straight, so she's now extended at the elbow joint as well. So let's recap here. You can see Sean on the top left-hand side is bent at the waist, so he's flexed at the waist. In the bottom right-hand side, Sean has straightened his spine, so he's extended at the waist. Since any flexion is moving forward of the anatomical position, and extension is to move back of the anatomical position, you'll remember our muscle man at the beginning of this lecture. His arms were facing forward, and his thumbs out to the side. That means that if he bends his hand downwards, it would be flexion from an anatomical position. If he turns his hands back or upwards in the picture on the bottom right-hand side, that would be extension of the wrist. When Julia tilted her chin downwards, it would be flexion, since she would be decreasing the angle from an anatomical position. Here you can see Julia's chin is up, which means she's extended at the neck. Lateral flexion means to move your body sideways. You may remember learning about the frontal plane, which divides you into front and back portions. If you were to stand with your back against a wall, you couldn't move backwards. You couldn't rotate around, but you could move down to the side. So putting your ear onto your shoulder or putting your waist down to the side is considered lateral flexion. Just as the torso can move into lateral flexion, your neck can also do that. Here you can see Julia tilting her head to the side. This is lateral flexion. Remember, there's flexion to the front when her chin is down, but this is lateral flexion, meaning she's moving to the side. Hyperextension means to move beyond a normal range of motion. In this picture you can see the woman's neck and her back a little bit is hyperextended. It's beyond what is normal, what she's normally capable of. Here you can see Julia doing external or lateral rotation. In the picture on the left, she's externally rotating her arms. In the picture on the right, she's externally rotating her leg. This is called external or lateral rotation. Internal rotation is also called medial rotation. This involves rotating a limb forward of the body. You can see the girl on the left is rotating her arms forward. The side view gives a different angle. You can see the woman on the right is rotating her leg inward. Again, this is called internal or medial rotation. So let's recap. Here, Julia is externally rotating her arm and her leg. It means to turn the arms outwards or turning the legs outwards. Here, Julia is turning her leg and her arm inwards. This is called internal rotation, also called medial rotation. Abduction and adduction refers to the action at the limbs, either away from or towards the midline of the body. In the picture on the left, you can see a man doing a jumping jack with his arms going out. This is abduction. Abduction means to take away. The woman on the right at the top is abducting her leg away from the midline. In the pictures on the bottom, the man's arms are coming towards the medial plane of the body. This is adduction or adduction. He's adding his limb back to the body. And the woman on the bottom right is pulling her leg towards the medial plane. This is adduction of the leg. In the picture on the left, Julia is bringing her leg and her arm towards the midline of the body. So she's essentially adding it back to the body. This is called adduction or adduction. In the picture on the right, Julia is moving her arm and her leg away from the midline of the body. She's abducting her limbs. She's taking them away from the midline. Rotation is to turn the bones around a central axis. Rotation occurs on the transverse plane. If you rotate the upper arm from the shoulder or turn your palms up and down, that's rotation. If you turn to look at something, that's rotation at the neck or at the waist. Circumduction means to move a limb in a complete circle. It's only possible at the shoulder and the hip joint. Here you can see an owl can turn his head almost all the way around. That's circumduction. Pronation and supination. Pronation means to be face down. In the bottom picture you can see Hero is face down doing a push-up. This means his head, his body, his feet are in a prone position. If you look at the top picture, Julie is in a supine position. Supine means to be hands up, face up, feet up. In this picture here, she is supine as she's doing an exercise called the dead bug. Supination and pronation can also occur at the arms. If you have your hands face up, that's supination. If you have them face down, that's pronation. The easiest way to remember it is if you're holding a bowl of soup, your palms are facing upwards, that's supination. If you have your palms facing downwards, as if you were playing basketball, you'd be a pro basketball player, that's pronation. Inversion and eversion refer to the position of the foot. Inversion is turning the sole of the foot inwards towards the medial plane. Eversion is turning the sole of the foot outwards away from the medial plane. The easiest way to remember it is inversion. If you were to do inversion, the picture on the top right hand side, you would injure yourself. So injury in inversion. Protraction refers to the action at the scapula. Protraction means to pull two bones away from each other. If you were to do a push-up on the up phase, as the arms come forward of the body, the shoulder blades are getting pulled away from each other. This is protraction at the scapula. As you go down into the push-up, as your body goes towards the floor, the shoulder blades are coming closer together. This is called retraction. Just as if you were to do a row and you were pulling the arms into the body, the shoulder blades would retract. Retraction is caused by the trapezius and the rhomboids pulling on the scapula to pull them together. We know that protraction means to pull apart. In this picture here, you can see Steve is in the beginning phase of a seated row. As his arms come forward, he's not only flexed at the shoulder, but his scapula have to be pulled apart. This is called protraction of the scapula, or in this case, his scapula is protracted. Retraction means to be pulled together. Here's Steve doing the in phase or the finish phase of a seated row. As he pulls his arms back, his scapula get pulled together, and this is called retraction of the scapula. So his scapula is retracted, pulled together. Elevation and depression also refers to the action at the scapula. If you move your shoulder blades up, that's elevation. If you move your shoulder blades down, that's called depression. So you can see how much movement we do have at the scapula. So let's take a look at the lat pull. In the picture on the left, you can see this is the beginning phase of the lat pull. You can see Steve's arms are completely above his head. This means he's fully flexed at the shoulder joint. It also means that his shoulder blades are lifted. It's called elevation of the scapula. As he pulls his arms down to the side, on the right-hand side, he's adducting his arms, pulling his arms down. But his shoulder blades are also coming down, and this is called depression of the scapula. So remember, the scapula can move up and down, or out and in. This is called elevation and depression, and protraction and retraction. The arms, however, will abduct and adduct on this plane of movement. Abduction is in the first picture, his arms are coming up to the side, and adduction is in the second picture, his arms are coming down to the side. His scapula is elevated, as his arms go up. His scapula is depressed as his arms come down. Dorsiflexion and plantar flexion refer to the action at the ankles. If you pull your toes up, this is considered dorsiflexion. Some people remember it by thinking about the dorsal fin on a dolphin, which is at the top or the back of the dolphin. So if you dorsiflex, it would be like rocking back onto your heels, pulling your toes up. If you do plantar flexion, you'd be standing on your toes. The way I remembered it was you plant your feet down. I've also had some students tell me that they would remember it by thinking about where you would get plantar warts. So dorsiflexion, pull your toes up, and plantar flexion, you push your toes down. As we'll see later about the muscles that cause these actions, it's important to know which one's which. Just as you can flex and extend and rotate, abduct and adduct at the shoulder, you can also move your arms along the horizontal plane. So there's a movement called the horizontal adduction and horizontal abduction. Moving a limb forward horizontally or along the horizon line is an example here on the picture on the bottom. This is called horizontal flexion. As Julie pushes up into a push-up, her arms are coming along the horizon line from her anatomical position. So it's called horizontal flexion or horizontal adduction. In the picture on the top, as Julie comes down into a down phase of a push-up, she's extending at the shoulder, but she's doing so along the horizontal line. So this is called horizontal extension, or also called horizontal abduction. In the previous slide, we saw Julie doing a push-up. Here you can see Steve doing a bench press. It's exactly the same movement at the arms. The arms are coming forward along the horizon line. In the down phase, in the picture on the top, it's called horizontal extension, also called horizontal abduction as the arms move downwards. And in the picture on the right-hand side on the bottom, you can see Steve pushing the bar up. This is called horizontal flexion or horizontal adduction. So let's analyze the push-up. In the picture on the top, you can see Julie is in the down phase of the push-up. So here you can see that her elbows are bent. She is in a flexed position at the elbow. Her shoulders, however, are moved back, and this is called extension of the shoulder. Her shoulder blades are pulled together, and this is called retraction of the scapula. Her body is in a prone position, meaning she is face down. Her hips are in a neutral position, but in neutral you can see that it's actually called extended. If she were to flex her knee, if she was to bring her knee down towards the floor, she would be flexed at the hip. So again, with the elbows bent, she's flexed at the elbow, and with her arm back, she's extended at the shoulder. In the up phase, in the picture on the bottom, you can see that Julie's shoulder blades are pulled apart in this picture, and this is called protraction of the scapula, or her scapula is protracted. Her arm, however, is brought forward at the shoulder, and this is called flexion of the shoulder. Her elbows now are straight, so she's extended out the elbow joint. Her body really hasn't moved, it's still face down, and her hips are still in the same position, so her body is prone and the hips are still extended. So just to recap, on the down phase, the scapula is retracted. On the up phase, the scapula is protracted. On the down phase, the shoulder is extended. On the up phase, the shoulder is flexed. On the down phase, the elbow is flexed, meaning it's bent. And on the up phase, the elbow is extended. So let's recap. Here Steve is doing a seated row on the top left-hand side. He's in the starting position, or in the out phase of the seated row. Let's take this piece by piece. Starting with his shoulders, you can see that his arm is brought forward, so he is in a flexed position at his shoulder joint. If you look at his scapula, they're pulled apart, so this is protraction at the scapula. His elbows are straightened out, and this is called extension of the elbows. In his hips, they are flexed. You can see that his hips are brought upwards, and his knees are also flexed. As his toes are also brought upwards, he's dorsiflexed at the ankle. So his hips will remain flexed, as will his knees and his ankles. In the picture on the bottom right-hand side, Steve is in the in phase, or the finished position, of the seated row. He's brought his arms inwards towards his side, and this is called extension of the shoulder joint. His scapula have been pulled together, so this is retraction of the scapula, and his elbows are bent, and this is called flexion of the elbow joint. His hips and his knees and his ankles have stayed the same. His hips are still flexed, his knees are still flexed, and his ankles are still dorsiflexed. The movement is coming from the shoulder girdle and the elbow joint. So to recap, in the picture on the top left, he's flexed at the shoulder joint, and in the picture on the bottom right, he's extended at the shoulder joint. In the picture on the top left, he's protracted in the scapula, means the scapula is pulled apart, and on the bottom picture, he's retracted at the scapula. Steve's elbows are extended in the top left-hand side, and they are flexed in the picture on the bottom right. Now you've learned some of the movements of the body. It's really quite interesting the amount of movement that the body actually has, and it is totally dependent on the type of joint. We've already looked at some of the synovial joints, ball and socket, gliding, hinge joints, etc. But now let's look at some of the specific joints in the body to be able to understand exactly how the body moves. You'll remember learning about the spine in a different part of this lecture. The spine, as you know, is made up of lots of different bones, which means there's lots of different joints, which means there may be different movement patterns between the joints. The joints between the vertebrae are called gliding joints. As you can see on the picture of the right, there's a facet that comes out of one of the vertebrae and goes up to another one of the vertebrae. These two plates actually slide against each other, allowing you to bend forward and back. This is called flexion and extension. You'll also remember learning about the atlas and the axis in the top part of the vertebrae. This allows lots of rotation to allow you to turn your head from side to side. Some parts of the vertebrae have no motion at all. The sacrum, which is in the back part of the pelvis, is 5 bones that have actually fused to one plate, so there's no movement in that section. If you'd like to know more about the spine, refer back to the beginning of this chapter to learn about the bones in the vertebrae. The sacrum is part of the sacroiliac joint. The sacrum, as you'll remember learning, is the back part of the pelvis, which is the bottom part of the vertebrae. This makes up the bottom part of your spine. The iliac crest and ilium, you can see here, is on the right-hand side. The iliac crest is the top part of the pelvis, and the ilium is the big bone pictured here on the right. The surface of these two joints, the ilium and the sacrum, have irregular elevations and depressions, like putting your fingers together. These create a partial interlocking of the bones. The bones are held firmly into place by strong ligaments throughout this area. The sacroiliac joints are synovial plane joints, which means they slide back and forth. But they do differ from other plane or gliding joints in the body because of the irregular elevations and depressions. The little bumps allow very little movement. They do move when you swing your leg forward and back, but they're held firmly in place by these strong ligaments and the muscles around it, primarily your gluteus maximus and hip flexors and some of your rotators. This provides a great deal of stability to the back of the pelvis and transfers the weight of the upper body from the spine to the hips, so it's important that the sacroiliac joint is quite strong. The sacroiliac joints are limited to a slight gliding and rotating movement, except if a great force is applied, like jumping down from a great height. The force of the spine is transmitted to each ilium of the lower limbs. The shoulder girdle, in my opinion, is one of the most interesting and intriguing joint areas of the body. Have a look at the picture here. You can see the circle in the middle. It's showing you where the clavicle meets the manubrium, or the top part of the sternum. Put your hand on that area now. Bring your shoulders forward and back, up and down, and rotate it around. And you can actually feel where the entire shoulder girdle attaches to the body by that one little area. That's why you have so much movement. Then if you have a look at the circle on the right-hand side, this is called an acromioclavicular joint, where the acromion process, that little part that sticks out of the scapula, attaches onto the clavicle. Both of these joints are freely movable gliding joints. The sternoclavicular joint in the middle resembles a shallow ball and socket. The joint in the shoulder girdle usually work together with the joints in the upper arm to allow a very large range of motion. So if you swing your arm forward, you can feel a lot of motion, not only coming from the actual shoulder, where the ball and socket joint is, but also where the clavicle meets the scapula and where the clavicle meets the sternum. Another interesting thing about this area is that the scapula is not firmly attached to the back other than with some muscles and some tendons. That's why you have so much range of motion. So in other words, the scapula has no bony attachment to the rib cage and relies strictly on muscles to hold it into place. The vast amount of movement permitted in this section, as I said, is elevation and depression, moving your shoulders up and down, protraction and retraction, moving the scapula forward and back, and rotation. It's really important that you have strong muscles in the back to hold the scapula in place. The humerus, the arm bone, is attached to the scapula at the glenoid fossa. This is a shallow socket. This shallow socket makes the shoulder joint very susceptible to dislocations for many reasons. The upper limb is suspended from the skeleton by a system of struts and is subjected to a constant pull from the arm bones due to gravity and the weight of things that you carry in your arms or your hands. This pull can increase the distance between the articulating surfaces of the joint, which means as you carry heavy things, it actually pulls one bone away from the other. The lack of bony support of the shoulder only increases the strain and the chance of injury. You need to have strong muscles around the shoulder joint to protect that joint. I'm sure you know of somebody who's dislocated the shoulder, and you can see why. That shallow joint isn't very stable, but the good thing is it does give you a lot of range of motion. Here's a picture of the elbow joint with the arm straight. The elbow joint is called the humero-radial joint. That's because the humerus attaches to the radius. This is a synovial hinge joint that works just like a hinge on a door. The end of the humerus is called the trochlea. It's shaped like a pulley and fits firmly into a notch in the ulna. The ligaments hold the trochlea firmly in place. The only movement permitted in the elbow is flexion and extension. The bony articulation severely restricts lateral movement. In other words, the way this joint is shaped, it doesn't allow side-to-side movement, only flexion and extension. Here you can see a picture of the lower arm. This is called the radio-ulnar joint because it's between the radius and the ulna, those two bones in the lower arm. These are actually three joints that work together as one functional unit. Most of the unit comes from the distal or far end of the joint where the radius actually rotates around the ulna. The upper portion of the joint, which is called the proximal or middle radial ulnar joint, allow very little movement. But the further you go down the arm, the more rotation you actually have between the radius and the ulna. Not only can you turn your palm up and down because of the movement between the radius and the ulna, but you have a lot of movement where your hand meets those arm bones, the radius and the ulna. The wrist, or radiocarpal joint, is a condyloid joint that allows movement in two planes. It has a concave and convex surface at the distal or far end of the radius, where it meets the carpal or the hand bones. In other words, it has like a little cup that fits into another cup. The wrist can do flexion and extension, palm down and up, abduction and adduction, moving side to side, and you can also move it in a complete circle. You'll remember learning about the bones in the pelvis and also the femur. The bones of the pelvis are the ilium, the ischium, and the pubis. Where these three bones meet, they make a socket or a little indentation. This is called the acetabulum. The femur then fits into this socket, so the name of this joint is called the acetabulo-femoral joint. It's a synovial ball and socket joint, and it's a very deep socket. It's not as mobile as the ball and socket in the shoulder, but it still permits a very large range of motion. The hip can do flexion and extension, bringing your leg forward and back, abduction and adduction, moving it side to side. It can also do medial and lateral rotation, turning it forward and back, and it can even do circumduction, but not as much as the arm, obviously. Because 2/3 of the head of the femur is in the socket and the ligaments around the hips are very strong, these are called the iliofemoral ligaments and are amongst some of the strongest ligaments in the body, There is a good range of motion, but certainly not as much as the shoulder, which means that we make up in strength what we lack for mobility. The knee joint is the largest joint in the body. The knee joint is made up of where the femur attaches onto the tibia, so it's called the humero-radial joint. It's a synovial hinge joint, and it's really quite complicated. If you have a look at the picture on the left, you can see how at the end of the femur there are two lumps on either side of it. These two lumps or bumps actually fit into grooves in the tibia. You can imagine how if a muscle on one side of the joint is much stronger than a muscle on the other, how it can throw this out of whack. If you've ever walked behind somebody and seen their shoes worn down on one side, that's because they walk funny and they scrape the shoe. The same thing can happen here. You can also see there's some meniscus, and a meniscus is basically a very hard cartilage in any place where there's trauma. It's very easy to destroy the meniscus in this area. This is designed to cover a very large range of motion. Unlike the hip, the knee does not rely on bony structures to contribute stability. The integrity of the joint is maintained by ligaments and muscles. It must support the weight of the entire body, and as a result is susceptible to injury and osteoarthritis. Osteoarthritis, you may remember, is a wear and tear disorder. The picture on the left doesn't have the kneecap on it, so you can see what the joint looks like. The picture on the right, however, does, and it's got the circle surrounding it. The picture on the right has the patella in front of the femur. The patella is the kneecap that rides on the front of the knee to protect it as you flex. Imagine if you bent your leg, how vulnerable that joint would be. Before we get into the technical aspect, I'd like you to do some movement with your foot. Turn your foot down and up, side to side, and rotate your ankle. There are several joints in the ankle and the foot that work together to allow a lot of movement. There's a joint that connects the far end of the tibia and the fibula, your leg bones, with the talus, the top bone near the top of the foot. You can see the bone is placed between the two arrows in this picture. The joint at the top allows you to point and flex your foot, so turn your toe down, plantar flexion, and bring it up. There's also a joint between the talus, that bone in the middle, and the calcaneus, your great big heel bone. And this is called a synovial plane joint that allows you to do inversion and eversion, moving the foot from side to side. So pointing your toes down and up comes from the upper joint, and turning your foot side to side comes from the lower joint. And lastly, we'll talk about phalanges. The phalanges are in your fingers and your toes. These are hinge joints at the knuckles that permit flexion and extension. There's a section in your book on biomechanics and levers. You'll learn more about this in the weight training course. In the meantime, let's have a look at how a lever system does affect the intensity of an exercise. In the pictures on the left, Renato is doing sit-ups. At the very top left-hand corner, he has his arms very close to his body. The point of pivot would be his waist. His arms are his weight. Biomechanics is all about the ease or the difficulty of a move. In this picture on the top left-hand side, he has his arms very close to the point of pivot, making the exercise easier to do. In the picture in the middle, he has his arms across his chest, making it a little bit more difficult to do as he's distributed his weight further from the point of pivot. On the bottom left-hand side, Renato has his hands close to his head, his point of pivot being his waist, but now he's moved the weights further from that point of pivot. If he were to extend the arms above his head, he would make the exercise even harder still. If you think about digging in the garden and you've got a shovel and you put some soil at the end of the shovel, you're going to put your arms down the shaft of the shovel to make sure that you're close enough to the soil so you can pivot the shovel up. However, if you were to slide your hands up to the top edge of the shovel, then you know how difficult it would be to try and lift up that shovel full of soil. Look at the pictures on the right-hand side. Renato's doing his push-up. He's on his hands and his knees. If he were to go up and down, there would be very little work for his body to do because it's quite a simple action. However, in the picture in the middle, Hiro is extended so his knees are further again away from his arms or his upper body. This is making the exercise harder to do. The point of pivot is his knees and the weight is his body. On the bottom right-hand side, Hiro has extended his legs out. The weight is his body. The point of pivot now is his toes. Again, The weight is further from the point of pivot, making the exercise harder to do. Please know this, as you will be asked these questions on the provincial exam. You're going to need to know which is harder and which is easier. Ligaments are tough connective tissue that connects bone to bone. They help stabilize and reinforce the joints. A ligament's elasticity varies with the joint that it's located in, and it will depend on your sex, age, and physical fitness. The elasticity of a ligament can decline as you age, so it's important to keep your muscles strong to stabilize the joints. Since ligaments don't have a blood supply of their own, they can take a long time to repair if they become injured. Overextending a ligament can cause microlesions or tiny tears in the ligament that will decrease their elasticity over time. Here you can see a picture of the knee. You may have heard of an ACL, that's your anterior cruciate ligament. You also have a posterior cruciate ligament. Cruciate means to cross. If you have a look at these two ligaments, they literally form an X. They prevent forward and back movement of the knee. We're going to discuss some of the exercises that can harm this joint further on in this manual. You can also see the lateral collateral ligament on the left and medial collateral ligament on the right. What that means, lateral means to the side or outside of the body, and medial means towards the middle of the body. Collateral means that they work together to prevent side-to-side movements. Tendons attach muscle to bone, or in some cases muscle to muscle. We'll discuss that a little bit later. These also have a limited blood supply, so if you do hurt a tendon, you'll know it because it will take weeks or possibly months to repair. If you've ever had tendinitis, meaning an inflammation of the tendon, you'll know it, as it can be a very painful thing to move that joint. Tendons, as I said, also connect muscle to muscle. In this picture here, you can see a picture of the rectus abdominis. It's broken up into 8 different parts. Most people think that the rectus abdominis, or your abs, are a 6-pack, but you can actually see how it is indeed an 8-pack. The bottom part, however, is usually covered up with some, what I affectionately call, potential energy, or fat. Cartilage is the shock-absorbing connective tissue between bones. There's no nerve or blood supply to cartilage. The articulating part of the bone is covered with a smooth, hyaline cartilage which reduces friction. Fibrocartilage is found in the center of joints to absorb shock. When a person has surgery to remove loose cartilage, the joint heals and is replaced with fibrocartilage. It's important to take care of your joints and vary your exercises, have the proper runners, and work on proper surfaces to avoid osteoarthritis. Osteo meaning bone, arthritis meaning inflammation of the joint. You can also see here something called a meniscus. You've probably heard people complaining that they have a torn meniscus. A meniscus is a fibrocartilage, or a very hard cartilage, at the end of each bones. And you'll find a meniscus at a point where there's a lot of stress in that area. So it's usually located in a hip, a knee, or an ankle. Perhaps the most important thing to remember in the study of the skeletal system is that you can make a difference on the strength of your bones. Heredity plays a large part of the bone's strength and makeup, but exercise can help stabilize the bones by strengthening the muscles, the tendons, and the ligaments that surround the joints in the prevention of injury, as well as increasing the density of the bones themselves. I hope you've enjoyed learning a little bit about the skeletal system. Let's move on to the muscles.